Today I'm going to talk about the real reason why black people are dying from coronavirus. Right, we've all heard the news about the increased death rates from black and ethnic minority people dying from coronavirus, but I'll focus mainly on black people. Now, the main theory has been that black people die from coronavirus due to low vitamin D. But apart from the fact that low vitamin D results in a weakened immune system, scientists and doctors have been unable to prove that this is the case. We already know that black people have low vitamin D for several reasons. If you want to know more about vitamin D, check out the video on vitamin D on my YouTube channel. My personal viewpoint is that vitamin D alone cannot account for this, because think about it, why would vitamin D be specific to coronavirus? Vitamin D, or lack of it, has become the red herring, or should I say, the scapegoat. However, having worked with COVID-19 patients for the last few weeks, I have noticed a trend among the hospital admissions due to severity of the symptoms. In addition, I've also looked at the profiles of the black people who have died from coronavirus, and I have noticed that they all have one thing in common. I really hate to say this word, but it is obesity. Yes, obesity for me is the number one reason why black people are dying from coronavirus. Okay, how does obesity cause this? We all know that obesity is one of the leading causes of deaths from heart attacks, strokes, and can cause other conditions such as diabetes, high blood pressure, joint problems, and many other problems. We also know that coronavirus can lead to blood clot in the lungs, and the medical term for this is thrombosis. If you're pregnant and your BMI is over 30, you normally put on blood thinners to reduce the chances of complications during childbirth, as well as giving aspirin during your pregnancy. Now, to back this up, here's some data from the US Office of Minority Health. Now, in obesity and African Americans, it has been shown that African American women have the highest rates of obesity or being overweight compared to other groups in the United States. So 4 out of 5 African American women are either overweight or obese. In 2018, non-Hispanic blacks were 1.3 times more likely to be obese compared to non-Hispanic whites. So in 2018, African women were 50% more likely to be obese than non-Hispanic white women. Now, here is more. Among African American adults, nearly 48% are clinically obese, and this includes 37.1% of men and 56.6% of women, which would compare to 32.6% of whites. Now, that is significant. You can then apply this info to other countries such as the UK, where there is no specific data on black people per se, but 1 in 4 people have shown to be obese. We have the second highest rates of obesity in the world, and the largest in Europe. And this has coincided with the fact that we have the largest death rate from coronavirus in the whole of Europe, don't you think? Now, if your BMI is over 30, you are up to 5 times more likely to have a blood clot in your lungs and legs compared to someone whose BMI is less than 30. Now you ask, how does obesity lead to blood clots? So here it is. If you're obese, you're less likely to be physically active, which means that there is reduced blood flow, so you're more likely to form clots. Also, the extra fat around your belly will stop blood from flowing through the deep veins. Obesity changes certain chemicals in the blood, which makes it more likely to result in an inflammation, which can also lead to blood clots. Now, I've already told you obesity affects the heart, so if you're ill from the virus which also attacks the heart, you're more prone to heart attacks. Obesity affects your lungs. Basically, the mechanical compression makes it less likely for your chest to fully expand to get in oxygen into your lungs. So you're more likely to have a reduced lung function and breathing problems. As we know, the virus also affects the lungs. So all these factors for me will be the main reason why black people, including other backgrounds, are dying from the coronavirus. And this is also in addition to underlying medical conditions such as diabetes and asthma. So it's important that you take steps to change your lifestyle, which would include exercise and changing the foods that you eat, which I'll discuss in another topic. And if you ever end up in hospital ill with COVID-19, which I pray you don't, make sure you're given blood thinners to reduce your chances of blood clots. And also top up on your vitamin D. Now, if you like this video, please share and subscribe to my channel and check out my other videos on coronavirus.